Dr. Wotring studies the actions of medications used during spaceflight missions, the effects of the spaceflight environment on physiology, and potential spaceflight-induced changes in pharmacokinetics and pharmacodynamics. She has held positions at Johnson Space Center and Baylor College of Medicine. She was Deputy Director and Chief Scientist of the NASA-funded Translational Research Institute for Space Health and is now a professor at the International Space University in Strasbourg, France. Today, the subject of her speech is medication usage on spaceflight missions. Dr. Wotring, you may start your presentation.
Thank you so much for the kind introduction. So we're going to talk about medication usage on spaceflight missions today. And I'm going to give you a little overview over time. Before we went on the very first Mercury missions back in the 1960s, before you were born, even before I was born, we didn't know what would happen to human physiology. The flight surgeons had discussions and they expressed a certain amount of uncertainty about whether astronauts would be able to eat and drink in flight normally. Would they be able to sleep normally? No one knew. Well, that's a lot to not know before you go on a trip, right? That's pretty significant. But they supplied a couple of medications anyway. They sent along preloaded medication auto-injectors just in case astronauts experienced pain or motion sickness. So they had treatments for both of those available for the crew members, starting with Gordon Cooper. These missions were really short. The longest one was 34 hours long. So the flight surgeons weren't expecting that there would be very much need for medication use. As missions grew longer in time, the medical kits got a little bit more complete. And also there were more crew members on these missions. The Gemini missions had 2 crew members each, and they lasted up to 13 days long. And they had a few more different kinds of medications. They had the pain and motion sickness treatments like before, but they also had some antibiotics and aspirin. And in addition, the flight surgeon team thought through the environment that the astronauts would be in just a little bit more. These missions had water landing. So making a part, at least a part of the medical kit accessible during that water landing was decided to be important. So they made a special landing kit that had some of those motion sickness treatments. If you're interested in more about the history of medicines and spaceflight, there's a really nice chapter in Barrett's Principles of Clinical Medicine for Spaceflight book, big, thick book. The chapter by Terry Taddeo and Cheryl Armstrong goes through some of this history, and it's really interesting. So the pharmaceuticals on the Gemini missions were a little more complete. We have a stimulant added. We have additional GI drugs added, some soothing eye drops, and a couple of decongestants available as well. In Apollo missions, we added a 3rd crew member, and the missions were getting longer. The missions were also starting to incorporate more and more tasks for the astronauts to do, so more demands on the astronauts physically. So the kits got a little bit more extensive. And you can see they're organized in a fashion where everything is labeled. And they're labeled not for a medical professional, but for an ordinary person, right? The crew members, even then, were given some training with respect to the medications that are available to them and what they might be used for. But it is recognized that most of the crew members are not clinicians. So the labels are made for people who are not clinicians. This idea of having separate medical kits for different kinds of tasks, different kinds of purposes, carried through to the shuttle days. And you can see here, there's a kit, one kit for treating trauma, and another one for airway needs, and another one for most of the drugs, another one for IV. And this idea has been working really well, and it's still used on the ISS now, separate kits for different kinds of treatments. You can see here, here's a kit, this is the ISS pack. Here's a kit for routine physical exam needs. Here are supplies in case anything surgical has to be done. Here's a dental kit. And what you can't see here, what's cut off in the photograph, in the top of the box, there are labels. So if you know what drug you're looking for, that label will help you find which kit it might be in. You might have noticed kind of a mass and volume problem. Spaceflight is filled with mass and volume problems, right? There's only so much room on a spacecraft, and it's very, very expensive to lift everything off of Earth. So we try and reduce the amount of stuff that we carry with us. Now, when I buy vitamin D at the pharmacy in the States, it usually comes in a bottle, and there's a bunch of pills in the bottle, and there's also a bunch of empty space in a bottle. When I buy actually the very same pills in Europe, they tend to come in blister packs, which we love from the point of view of medication stability. Every one of these pills is still individually wrapped, even though I've started using the pack. So that's a nice feature. But again, there's a lot of packaging material here, and this is not very good when it comes to trying to carry everything you want in almost no mass and volume. So the pharmacists at JSC developed a practice of repackaging their drugs mostly into small zip top kinds of plastic bags. These have virtually no protection, and medication stability is an issue here. This is handled right now on ISS missions by the ground pharmacists, keeping track of the expiration dates of these meds, and they just get replaced. There are very frequent resupply missions. Replacing them is not an issue. This won't last when we go on exploration missions. So that works great for now, but it's not a long-term kind of a solution. So I've kind of brought up a few things that we think about when we're choosing mission pharmaceutical kits and the medicines that go in them. The mission length makes a difference. The number of crew, the kinds of tasks they're going to be doing, EVA, extravehicular activity, special research activities. If we were to do landings on another planet, all of these may have special medical risks associated with them. And you would have to plan for that when choosing what goes in the kit. We can use past missions to help predict what usage might be. We've also incorporated into some computer modeling, really nice modeling. It's called the Integrated Medical Model, run out of Johnson Space Center. Dr. Eric Kirstman with a K has run most of it. They have made a computer model using not just spaceflight missions, but Antarctic missions, submarine missions, lots of other different kinds of remote closed environments to inform this model. So they can make pretty good predictions of what might be needed. At the same time, we keep looking at new risks to human health in space. And those are being identified all the time, even now. Recently, in the past 10 years or so, we identified spaceflight-associated neuroocular syndrome, which is a change in astronauts' vision. This happens more on longer missions, which is probably why we didn't notice it until just about 10 years ago. And within the past year, we have reason to believe there might be a risk of venous thromboembolism in space as well. At the same time, we're monitoring, and the JSC pharmacists do a real good job of this, monitoring new medications as they become available through the drug approval pipelines, not just in the States, but also in Europe and other places, to see if there are new medications they want to consider adding to the kit. So we've been going to space for a while, right? Since the 60s. And we've been performing different kinds of biomedical measurements the whole time. At first, it was relatively crude and not well planned the way we would do a biomedical research study now, but it was more opportunistic or meant to monitor the health of an individual crew member rather than be a research study. Now we've got research studies going on all the time for many of the crew members, as want to sign up for the research studies. And that's in addition to routine medical monitoring that's going on all the time. Every physiological system that we've studied shows some kind of change in space. And I'm showing you on this chart that probably you've seen before. It's a pretty common one in our space world. The scale on the x-axis is in months of time in space. And the y-axis is a little bit weird. So for every one of these different systems, we set an arbitrary clinical horizon. So above this line, there would be a clinically significant issue. Below this line, in 1G, would be normal where we are now. Anywhere else below this line is where we can measure a difference, but it's not a clinical problem of any kind. It's just that we can measure a difference. And we see that the neurovestibular system makes some very rapid adaptations when we leave gravity. And then it readapts to kind of what we call space normal and pretty much stays still over the course of even a long mission. Fluids and electrolytes go through a similar kind of shift, as does the cardiovascular system and red blood cell mass shift and then almost return to normal. Effects on bone and calcium metabolism continue over a long duration flight, and any effects of radiation just accumulate over time. Very, very low dose radiation exposure in low Earth orbit, but it's every day 24/7 for the entire mission. We have almost no information what happens after 6 months. Only a few people have stayed longer than 6 months. So we're not sure if these curves stay flat or if they go back up again or if they drop back down. We just don't know. There have been a variety of medical complaints noted by crew members in space. On the space shuttle, these are shorter missions, 7 days to 16 days. Here's a long list of issues that were noted. It's not very different from what has been seen more recently on ISS missions. And you can look at Gilles Clement's Fundamentals of Space Medicine book for this. People have GI problems, trouble with sleep, with hydration, body pains, pesky little infections, headaches. It's really ordinary stuff. If you looked at any healthy adult population over a period of time, you see pretty much the same kinds of issues, with the notable exception of space motion sickness. So that is really unique to space. But everything else is really kind of ordinary. And we use the same medications to treat these individuals as we do on Earth. And there have been a few studies done of pharmaceutical use in spaceflight missions. Here's one with the data taken from medical records of station crew members, ISS crew members, US crew members as well. These data, this was actually one of the very first things I did when I started working at Johnson Space Center. I went back into the medical records for the past 10 years and pulled out these data. And it was a total of 277 medication uses that I've organized here by indication. It's from 24 crew members on 20 different missions. Remember this number, 277, and 10 years. And you see that people are treating sleep issues and body pains and congestion or allergy symptoms. Space adaptation syndrome is another name for space motion sickness. EVAs is extravehicular activity, ordinary kinds of issues. But I felt like this 277 medication uses by 24 crew members over a 10-year period was a low number, was an underestimate. And in fact, when I gave a draft of this manuscript to one of the flight surgeons to read before I submitted it for publication, he scribbled on it over in the side, you know, this is a vast underestimate of the med use, right? And so we talked about that. And it's like, yes, I do really think it's a vast underestimate. Do you have any idea how much? And no, I don't know how you put a number on it. No one's even tried to do that. So I figured maybe we needed a better way to attack this issue. And I asked NASA's Human Research Program to fund a new study. And I proposed doing something kind of similar to what the nutrition folks do, to ask crew members about what they eat every week. So I understand Scott Smith is going to talk to you later. He's awesome. He helped me with this study quite a bit. We designed an app for the crew members to run on their own iPads and use whenever they wanted, as often as they wanted, to note when they used a medication in space. And the deal was, you sign up to do this study, and at least once a week, you would go into the app and you would tell it what medicines you had used. And if you hadn't used any medicines that week, you just click the button that says, I didn't use any medicines this week. Simple. We asked people to do this during their mission, and we asked people to do it for the same duration of time on Earth, so we could have grounded flight. And this has been published. It's in Aerospace Medicine and Human Performance. We only had 6 subjects before NASA decided that the point had been proven. Those 6 subjects recorded 5,766 medication uses. Now, remember, it was 277 before. That's with only medical records data being used. If we go directly to the crew members and ask them to share this information directly, they did. They really did. Apparently, there were not significant barriers concerns about privacy. We had many levels of security on these data, and the data were coming to us in the research side of the house. They were not being shared with people who make flight assignments, for instance. The crew members were just amazing. At the same time, they made some criticisms of our app. There were a number of things they didn't like. They didn't like the buttons. They didn't like the colors. They didn't like quite a laundry list of things, which I think are all easily solved. But the point is proven. If you ask the crew members, they tell you more, which is awesome. Now, if you're curious about what some of the drugs were, I am not at liberty to share that with you, but most of the 2012 ISS medical kit was published by Julia Stengel in this +1 article, if you want to see what some of the drugs are. Older kits are available too in some of those, in that Taddeo book chapter that I mentioned. So let's talk for a second about sleep meds. With the bigger data set, we see again that sleep medication use is high. It's one of the highest among the astronauts. And this isn't a big surprise. There have been quite a number of other studies about sleep in astronauts. Laura Barger has a really good one in this Lancet Neurology paper. The astronauts, this is in flight, sleeping around 6 hours a night. They're not getting enough sleep. They want to sleep more, but they're having trouble sleeping longer than 6 hours. So they take medications. And we see that in our data set. 5 of the 6 crew members in our data set used sleep medicines more in flight than they did on the ground. We see use of pain relievers. And in our app, we gave the crew members the option to write little notes about why they used the medicine, what was going on. And we had a number of notes about muscle or elbow or back pain or shoulder pain or something related to using the exercise equipment, that's the ARED, doing an EVA. A lot of the exercise and the tasks that they do give them sore muscles and joints. They have to work hard to do their job. And most of them are over 40 years old. And a lot of people who are over 40 years old and working out hard take pain medications. That's the same as on Earth. The third most popular category of drugs used on the station is for congestion and allergy. And we think this probably isn't true allergy. We suspect that the cephalid fluid shift makes people feel like they have sinus congestion. You can see the change in this astronaut's face during his mission. He's got a puffy, rounded face here. There is a possibility of allergy, but we're not sure about that. And we have a number of crew members report using these kinds of medications for apparent symptomatic relief. We also treat some rashes in space. These and some other immune dysregulation issues have come up previously. It's been noted that astronauts who get cold sores get them in space, and quite a number of biochemical immune measures are changed in space. Brian Crucian from the Johnson Space Center Immune Lab has done some beautiful work on this. In my previous paper, we noted that about 25% of astronauts get rashes that are bad enough to treat. And some of them get a persistent rash, unresponsive to treatments that persist throughout the flight. And that is concerning for me. We had in our group of 6 individuals, one who reported use of every topical drug in the kit with no relief, and then followed that with oral antihistamines, oral steroids, trying to get better relief. The rash resolved after this person returned to Earth, but that person was under treatment for the entire mission, which makes me wonder if this is a very unusual rash or if we didn't actually supply the best drugs to treat it. Space motion sickness or space adaptation syndrome is a reason for taking medications, usually just the first 1, 2, or 3 days of a flight. This adaptation occurs relatively quickly in time. People may feel pretty uncomfortable, but it's usually not for very long. There are some people who take treatments for space motion sickness in a prophylactic fashion as well. That could be scopolamine, or it could be promethazine or meclizine. Those are the 3 most common medications for this right now. Other meds that crew members take, many of them take vitamin D. As you know, the crew members don't have access to sunlight to make vitamin D through the skin the way we can. so many take a supplement. Some crew also use a multivitamin, usually one with no iron. We don't have issues with crew members having low iron. And in fact, the diet supplies a lot of iron, perhaps more than is actually needed. Much of the food is from the United States. And in the United States, since the 1920s or so, it's been common practice to fortify all the wheat flour with iron. So every tortilla and many other products has a decent dose of iron in it. Crew also report use of various heartburn preventatives, cholesterol controlling medications, hormones, usually for menses suppression, all very typical for healthy adults. So what are in-flight issues that the crew members might experience? We talked a little bit about neurovestibular maladaptation and sleep disturbances. Kidney stones, renal stones are another potential issue. We've seen this in a number of astronauts, most of whom don't manifest an actual stone until after a flight. There have been a couple of in-flight scares, but nothing really serious. We also are now aware of spaceflight-associated neuroadaptation syndrome, that should read. It's called SANS for short. This is a change in astronaut vision, usually a shift in someone's eyeglass prescription. Some cases have had more significant clinical findings. Some of those cases resolve after return to Earth, and some don't. Right now, we don't know a cause, and we don't have a treatment. We also have concerns about the possibility of radiation damage. Now, in low Earth orbit, exposure levels are relatively low. We get some protection from the Earth's magnetic field. When we begin going on longer duration missions, we won't have that protection. Doses will be about 3 times higher. So in addition to a longer duration mission, the exposure rate, the dose rate will be higher. And we're not quite sure what to expect with that. Right now, the countermeasures are, if there's a neurovestibular maladaptation, treat it. We have anti-nausea drugs, and just wait a few days. Sleep disturbances, we can treat with medications. We can also try to prevent. There have been great improvements in sleep hygiene among the astronauts themselves. They have learned better tricks about how to get ready to fall asleep. Don't look out the window where you might see a bright sunrise happen. Don't do that right before bed. The light bulbs inside the station are being replaced with models that have a natural kind of a spectrum and one that can be varied during the day to be bluer in the morning and redder in the evening to help set some circadian cues. So we expect that sleep disturbances might be getting easier as some of these behavioral and environmental conditions get changed. Kidney stones, there's a big project to prevent and detect before anything ever develops and needs treatment. There is potassium citrate on board to help treat stones if they do form, as well as ultrasound for help diagnosing and perhaps breaking up stones or moving them. The SANS vision changes, I mentioned, we don't know a cause, we don't have a treatment. So that really is a big question mark. This is going to be one of the things that your generation has to figure out. Possible radiation damage, well, at this point, we don't have any astronauts who are exhibiting radiation-associated issues. Not in flight, certainly no. And in fact, we aren't even convinced that we're seeing radiation issues after flight. So in the absence of a condition to treat, we don't treat. Plus, there's the issue that we don't have a really good medication to prevent or reverse any radiation damage that might happen. There are a couple of drugs approved for use in acute radiation syndrome, but that is definitely not happening with astronauts. Landing condition of the astronauts is a little bit different. So rapid return to a 1G environment after having adapted to a low gravity environment is hard on the body. Quite a few astronauts suffer from orthostatic hypotension the first few days. That is, if they stand up too long, they may faint. They may suffer from muscle weakness and atrophy or from loss of bone mineral density. They may suffer from neurovestibular maladaptations and in the first few days, and that would be in the form of feeling disoriented or dizzy when moving around. Turning corners, they tell me, is really tricky. And in fact, I've seen crew members just a few days after coming back to Earth walk down a hall, turn a corner, and then reach out and have to grab the wall after they realized they did that a little too fast. We're seeing SAN's vision changes. We don't know yet about the radiation damage. Crew members, after returning to Earth, sometimes get cataracts, maybe a little earlier in life than they would have otherwise, but that's a little tough to tell. Waiting for a couple decades after a flight, it gets harder to assign causality to that sort of thing. We have some countermeasures for these Earth readaptation issues. For orthostatic hypotension, we can prevent that by asking the astronauts to load up on water and salt just before they come back. There are also some regimes using devices to prevent fluid from moving up in the body, different kinds of straps or belts, or even vacuum devices to pull fluid lower in the body. For both muscle weakness and atrophy and loss of bone mineral density, we have found that in-flight exercise as well as good diet makes a huge difference. Scott Smith will tell you all about this later. I originally had slides in here about this, but when I realized he was talking, there's no need for me to tell you about it. They have a really good suite of countermeasures. For neurovestibular maladaptations, if there's nausea, treat, limit for the first few days back to Earth. Certain duties are limited. You have to wait a few days before your flight surgeon will let you drive a car on your own, for instance. And even walking down a hallway, you might want to handle carefully. And we don't know what's going on with SANS, so we have no countermeasures for it. And for radiation damage issues, we know that our astronauts don't get acute radiation syndrome. And we only give our astronauts medications when they're needed and they're proven. So we're not treating any of that. But we have some new challenges ahead of us, right? If we're going to go farther away, if we're going to go back to the moon, if we're going to go to the Mars, these are going to be longer missions. And this relatively simple suite of countermeasures we have available to us now might not be adequate. So before I turn the floor over to the next speaker, I want to encourage the students in the audience now. There are some open questions here to work on. So we need some attention on some of these issues. There is work to do. And the time frame we're talking about here, NASA is thinking about going back to the moon in the 2020s, this decade, and maybe to Mars in the next decade. The time frame is rapid. So y'all need to finish up your degrees, okay, and get to work on some of this. Thank you so much for your attention.